Hello everyone. So today we're going to talk about respiratory and cardiovascular systems and how we are going to care or what are the effect of aging on them. By the end of this lecture, you'll be able to explain the normal changes caused by aging in these two systems, in addition to how nurses can manage the common diseases that are affecting the cardiac and respiratory system. In addition, you will know the nursing implications of these changes on respiratory and cardiovascular. So these changes, the changes in these two systems, as we mentioned before, are highly individualized, meaning that every person is different than the other in the way how their body is affected by the aging process. So at a cellular level, our body's change starts from the cellular level, and the number of the cells are reduced. In addition, the lean body mass, totally it will be reduced. Also, the total body fat increases, as you know. There will be also a decrease in intracellular fluid, in addition to a decrease in the water that is the biggest composition in the body. By age 40, or the fourth decade of life, as you may know, that there is a hair loss, gray hair appearance, wrinkles, atrophy of body fat, and loss of tissue elasticity in general. In addition, there is a reduction in skin fold thickness, unlike adults and children. There will be also a decrease in stamina. So this is a picture that depicts all the aging changes that happens. So you can see here in the picture, there is a thickening in the hair around the ear and nose. Also, there is darkening and wrinkling of the skin. There is, for example, a narrow gait in women and a wider gait in men, in addition to the other changes that we have talked about in the. So let's start with the respiratory system. So what changes do we normally see in the respiratory system? So what happens in the respiratory system? Usually there is a reduction in the respiratory activity because of so the lungs will be having less expansion. The residual capacity also be increasing. There will be also a use of accessory muscles, therefore, because of that. And sometimes also there is a change in vital capacity and elastic recall. The alveoli are less elastic, and they also develop fibrous tissue, especially in those who are having COPDs. There is a reduction in the vital capacity in general, as I mentioned, and an increase in the residual volume, the remaining volume that remains in the lungs. So as the residual volume increases and the vital capacity is reduced and the maximum breathing capacity decreases, placing older adults at high risk for developing respiratory infections because there is no change in their lungs, not normal breathing. So this picture again shows you how the changes that happen with aging. There is, as I mentioned, a decrease in the ciliary action, so which means that there is less ability to fight infections and dust. There is also blunting cough, or what we call laryngeal reflexes. By the age of 90 years, for example, there is approximately 50% of increase in residual capacity in older adults. Also, respiratory diseases are the leading cause of disability and the fourth leading cause of death, So, and we will talk in a minute about these diseases. Respiratory problems also develop more easily in older adults than in younger adults, and they are also more harder to manage. So as I mentioned before, there are a lot of structural things that happens. So in terms, for example, of nasal passages, there is the nasal passages accumulate more dust and dirt. They are not now, the ciliary actions are very much reduced. There's also drier mucous membranes. In addition, there are problems with loose teeth that may cause lung abscess. There is also relaxed sphincters and slower gastric motility, which is risk for aspiration in older adults. So often overlooked in the prevention of respiratory problems, the healthy oral cavity, as I mentioned, is very much dismissed and overlooked, especially here in Oman. That's why we have a lot of infections of the oral cavity, which can lead to respiratory infections. What can we do to promote respiratory health? Number one, as I mentioned before, we need to do some preventive or we need to prevent infections, such as treating the loose tooth, treating the infections that happen very early in the process, giving the patient vaccines such as influenza and pneumonia vaccines, and avoiding exposure to people who are sick. In addition, continuously to instruct the older adult to take deep breath, because deep breathing exercise can help in exchange the air in the lung. And of course, smoking cessation is one of the biggest issues that we are facing when we talk about respiratory health promotion in older adults. Also to avoid outdoor air pollutants and to improve the indoor air quality by opening, for example, the windows every morning and every afternoon. Please review the medications and potential impact on respiratory function from your. What are the common respiratory diseases of older adults? Number one, pneumonia, asthma, chronic bronchitis, emphysema, lung abscess, COPD, and cancer of lungs. These are the most famous common respiratory diseases of the older adult. We need to consider as nurses that we need to do prompt medical attention with signs of respiratory infection, such as an increase in body temperature, because there is a risk, or if untreated, there is a risk for pneumonia. Also, there is no signs of chest pain in older adult usually, so we don't know about pneumonia, for example, very early in the process, which leads to more complications later on. We need also to do close monitoring to minimize disability and prevent mortality, such as by monitoring the body oxygen levels, and also to monitor, for example, the sputum colors. Okay, so we need also to consider safe oxygen administration, because it can cause a lot of what we call oxygen toxicity in the older adults. Also, we need to monitor for carbon dioxide narcosis, and we need to assess the oxygen equipment frequently. Okay, so this picture shows you here, if the oxygen is not monitored very closely, it can cause a high level of oxygen, or what we call oxygen toxicity again, in the brain, which causes depression of the respiratory stimulus, which reduce respirations and therefore increase the carbon dioxide retention. And this can lead to coma, and it can cause restlessness. So from restlessness to coma, it can cause restlessness, irritability, dyspnea, and coma in some severe cases. Postural drainage is one of the important strategies or medical managements that we use in older adults to improve respiration. And what we mean by postural drainage is to use certain postures, and I will show you some pictures of that, and you can see it also in your book, so that all the sputum and all the excretions can be drained to one side and then go outside the body. So we utilize it also to remove bronchial secretions, especially in in patients who are having bronchiolitis, for example. Modification of the procedure for older adults, for example, in when they are in coma state, or those who cannot move, we need to change their positions to for postural drainage. And oral hygiene is very much important when we do postural. Another nursing consideration, which is to promote productive coughing, because non-productive coughing may be useless, and also it may use a lot of energy from the older adult. It requires a lot of energy. That's why we need to promote productive cough. So how to promote a productive cough? Number one, we need to do breathing exercise, and also we may induce it by humidification. We may use expectorants, like the fluid expectorants. Also, we can increase, or we instruct the older adult to increase fluid. A practice question, and I will post this in your discussion part or the chat box. Which of the following assessment findings is considered a normal change in respiratory system associated with aging? Decreased residual capacity, increased lung capacity, increased lung expansion, or decreased ciliary action? Of course, number D is. Now let's move to the cardiovascular system, which is very much interlinked with the respiratory. So what changes do we see in the cardiovascular system? Number one, the heart size unchanged in absence of pathology. Usually it doesn't change. However, there are a lot of issues that happen in the cardiovascular system that may affect the heart size. So the valve becomes thick and rigid, the heart muscle loses efficiency, there is a reduction in the cardiac output. There is also a reduction in the elasticity of blood vessels. There is an increase in the peripheral resistance, which is like in the case of hypertension. In terms of circulation, the effects of improved technology for early diagnosis and treatment has been improving the circulation or the cardiovascular system in general, such as treatments of MI, treatment of heart failure, early treatment of or early medical management of hypertension. However, the cardiovascular diseases are still a major cause of disability and death in older adults. They are the #1 killer here in Oman. Our nursing interventions are very important, especially that they can address potential problems that are related to the cardiovascular system. So again, here in this picture, we can see the effects of aging. So the aorta becomes dilated and elongated, the cardiac output decreases. Also, there is a resistance in the peripheral blood, which increases by 1% per year. Also, and that's why we see that high blood pressure is more common in elderlies. Blood pressure also increases to compensate for increased peripheral resistance, as I mentioned, which in part affect also the cardiac size. There is less elasticity of vessels. There is also less efficient utilization of the oxygen. The heart is pigmented with lipofuscin granules, which is not going to affect the heart muscle exactly. However, it's one of the changes that has been observed. Stroke volume decreases by 1% per year, which is a very important thing to keep in mind, because we see that the contractility and the stroke volume decreases in older adults. Valves also become thicker and more rigid. Also, there is more prominent arteries in head, neck, and extremities, as you mentioned. More time also is required for the cycle of diastolic filling and systolic emptying, which takes the heart a huge amount or huge effort from the heart. And there are like many conditions that can alter also the tissue perfusion that are often found in older adults and also affect the cardiovascular system. The symptoms of age-related changes in cardiovascular system also become apparent when the older adult is faced with unusual physiological stress. So, for example, if they have infection, the heart will be beating very fast. Also, there are like the blood pressure also increase with pain. They are more prominent with any other physiological stressors. Also, the age-related changes in the cardiovascular system are typically gradual and become most apparent when the older adult is faced with unusual physiological stress, as I mentioned, such as heightened activity or infection. So they are more gradual. Nutrition is very important, and following dietary guidelines are very crucially important, especially when we talk about the health promotion of cardiovascular system in those patients who are hypertensive or who have heart failure, for example. So adequate exercise and lifestyle modification to increase the HDL and reduce the low density lipoproteins. Also, there is a need for distribution of exercise throughout the week. And so regular exercise are very much recommended, at least 30 minutes per week. Our nursing intervention should also focus to promote activity such as aerobic exercises, strengthening exercise, balance exercise, yoga, and Tai Chi. One of the very important aspects of cardiovascular health promotion is using aspirin, and also aspirin to decrease the chance of any clotting, in addition to avoid or reduce alcohol consumption. Of course, in our society it's very hard to detect who is drinking alcohol, but it has been increasing. That's why I brought it here, so that you know that this is one of the points for you to consider in the future. Also, to avoid cigarette smoking, because it does affect the blood vessels. It increases the rigidity of the blood vessels, and that's why it may increase the blood pressure, for example. It also affects the heart size. Acupuncture is one of the new strategies that has been proposed in many literature that can also increase or promote the cardiovascular health. In addition, we need to regularly or annually do a medical checkup that is comprehensive, but also very much focused on cardiovascular system. One of the managements that we need to do is also stress management. Stress is, as you know, is a normal part of life, but in older adults we need to decrease stressors, so that, as I mentioned, stressors may have a magnified effect on older adults that is different from the younger adults. One of the famous conditions, or the most important conditions to talk about when we talk about cardiovascular health, is hypertension. And as I mentioned, the incidence increases with age. It's the most prevalent cardiovascular disease of older adults. And we need to evaluate it very frequently. The systolic blood pressure should be not more than 140. The diastolic blood pressure should be also not more than 90. Factors also to consider when monitoring blood pressure is the age, the body mass index, and also genetics. The signs and symptoms may include pain around the eyes, throbbing headache, and also generalized body fatigue. The treatment is by the changes in lifestyle, and also to decrease the potential for the any dangerous decrease in blood pressure with aggressive antihypertensive therapy. So we need to use them very wisely and very close monitoring for the antihypertensive therapy. Hypotension is one of the also most common disorders related to cardiovascular systems. So postural hypotension is the most famous type of hypotension faced by older adults, especially that they have a decrease, for example, in all over body fluids and in changes in cardiovascular system in general that may cause postural hypotension. It is also related to vasoactive medications and also decreases baroreceptor activity, the decreased baroreceptor activity in older adults. This makes them at higher risk for falls, stroke, syncope, and other coronary complications that we need to consider, especially the risk for falls. So, for example, hypertension may happen when they stand up from the toilet seat. This is one of the famous reasons for falls. Other cardiovascular problems that you need to keep in mind, such as coronary artery diseases, myocardial infarction, angina, hyperlipidemia, and congestive heart failure. Also pulmonary emboli, arrhythmias, peripheral vascular diseases, varicose veins in their skin, and then venous thromboembolism that can happen very easily in older adults, and aneurysms, especially the aortic aneurysm. A nursing consideration should focus first on prevention, such as by using education, by counseling, and by coaching and rehabilitative and restorative activities that may facilitate the prevention of the primary, secondary, and tertiary complications of cardiovascular diseases, such as what I mentioned about hypertension. Also, we need to keep our patient informed, so we need to explain and reinforce the necessary teaching points, such as, for example, how to use antihypertensive medication. We also need to prevent complications, which is the secondary line of prevention. So by preventing edema resulting in skin breakdown, so by elevating them, elevating the legs, for example, in a high chair, fluid balance, assessment and changes in vital signs, and also to carefully administer oxygen, as we explained previously, because patients are they have the risk for anorexia. Also, we need to make sure that they are drinking enough fluid and eating good nutrition also. So dietary precautions are very important, especially for those with heart failure and those with hypertension, as I mentioned. So salt reduction is one of the very important strategies to do that. Also, we need to promote circulation. So how to promote circulation? We need to increase the risk. Because of the increased risk of altered tissue perfusion, our intervention should focus on improving tissue circulation, such as by moving, exercise, and also massages can improve the circulation, especially in the and prevent peripheral vascular problems. So food care, one of the very important care aspects that we need to consider when we talk about circulation, because people with peripheral vascular diseases may have what we call wounds or lesions because of that. So they need to take a bath and inspect them daily after bath. They need to avoid injury by wearing the appropriate footwear, and to pay attention to lesions and any fungal infection. They need also people with peripheral vascular diseases, they need to take, as I mentioned, a good care of the ischemic foot lesions, because they can progress to be like a very dangerous lesions or wounds that cannot be managed later on. That's why it may cause them a loss of limb also. Practice question here. 70-year-old patient is complaining of edema in the lower legs and history of congestive heart failure. Which action should the nurse advise the patient to take to reduce the edema? Reduce intake of carbohydrates, reduce amount of exercise, reduce intake of water, or reduce intake of salt. And of course, D is the right answer. So in summary, there are like inevitable changes of aging that are highly individualized, so they're different from one person to another. These changes are also different in various body systems. Respiratory diseases are the leading cause of disability and the fourth leading cause of death. In addition, cardiovascular diseases are the #1 killer in older adults.